From the upper limb, that is, the hand would be the manus. We divided the manus into a proximally located area made up of the carpal bones, which we call the ossa carpi. Distal to these are the ossa metacarpi, and most distally are the phalanges, that is, the finger bones. First, it's worth examining the ossa carpi, the bones that make them up. In the case of the ossa carpi, that is the carpal bones, we can say that there is a proximal row of bones and a distal row of bones. The proximal row is called, in Latin, nicely, ossea carpalia proximalia, while the distal row is called ossea carpalia distalia, and the bones that make up these rows are usually listed in a radial nerve, that is, from lateral to medial direction, as is customary. The most radial, that is, the most laterally positioned bone of the proximal row is the os scaphoideum, that is, the scaphoid bone. Next comes the os lunatum, which is the lunate bone, followed by the os triquetrum or the triquetral bone. After that comes the os pisiform, the pisiform bone. The most lateral bone of the distal row is the os trapezium, the trapezium bone, then comes the os trapezoideum, the trapezoid bone, followed by the os capitatum, the capitate bone, and then comes the os hamatum, which is the hamate bone. The easiest way to remember these is by using mnemonic words. For the proximal row of bones, the term scalutripi can help, as it allows us to recall both the constituent bones and the order in which they are arranged. For the distal row, the mnemonic tratrakaha can be useful. What is important to note above all about these bones, due to the threefold, if we look at where each is located, we see that they are not necessarily positioned right next to each other. For example, there is a bone called the os pisiform, which is notably situated on the upper surface of the os triquetrum in anatomical position, and together they form a groove through which various structures pass and enter the area of the hand. This area is called, in the case of the bony hand, meaning before we add ligaments and other structures, the sulcus carpi. The sulcus carpi has a side that is positioned radially or laterally, and another side that is positioned medially or ulnarly. The medial side of this groove is called the eminentia carpi radialis or eminentia carpi lateralis, while the side that is positioned medially or ulnarly, the side of this groove is called the eminentia carpi ulnaris or eminentia carpi medialis, and it's also important to know which structures form these eminences. Of course, the diagram is very schematic. It shouldn't be imagined exactly like this in reality, but it can be helpful. Both the eminentia carpi radialis and ulnaris are formed by different bony structures, medially, and more precisely, both proximally and distally. The eminentia carpi radialis, proximally, is formed by the tubercle of the scaphoid bone, which we call the tuberculum ossis scaphoidei, while distally it is formed by the tubercle of the trapezium bone, the os trapezium, which we call the tuberculum ossis trapezii. The eminentia carpi ulnaris is also formed by two bony structures. One is a single bone. Proximally, the os pisiform forms it, which is located on the upper surface of the os triquetrum. And distally, a characteristic structure of the hamate bone, also known as the os hamatum, forms it, which we call the hamulus ossis hamati. The last major region of the free upper limb is the hand, or manus, which we can divide into the carpal bones, ossa carpae, the metacarpal bones, ossa metacarpi, and the fingers and phalanges, commonly called phalanges or phalanxes. The carpal bones have a proximal and a distal row. The most radially positioned bone of the proximal row is the scaphoid bone, os scaphoideum, followed by the lunate bone, os lunatum. Then comes the triquetrum, os triquetrum, and on the triquetrum is the pisiform bone, os pisiforme. The distal row also consists of four bones. The most radially located is the trapezium, os trapezium, followed by the trapezoid bone, os trapezoideum, and after the trapezoideum, the capitate, and finally the hamate, os hamatum, which has a special feature, the hook of the hamate, hamulus ossis hamati. These structures form the eminences. These characteristic features make up the medial and lateral carpal eminences, and between the two lies the carpal sulcus, through which various structures pass, such as tendons of muscles, or for example, a nerve. This nerve is called the median nerve, but we only refer to it as the carpal sulcus if it is not covered by any ligaments or other structures. In this case, we simply call it the carpal sulcus. If the ligaments also cover it, then we refer to it as the carpal canal, so in that case, it is considered a canal. Good, there are a total of 5 metacarpal bones, which we call the metacarpals. At first glance, it is clear that these are classic long bones, which have the following features. The previous, just like before, have a proximal epiphysis, a distal epiphysis, and a diaphysis located between the two. In the case of the metacarpal bones, we use special terms for these parts. The proximal epiphysis is always called the base, the distal epiphysis is called the head, and the diaphysis between the two is called the shaft. Both the proximal and distal epiphyses also have distinct articular surfaces, which we precisely call articular facets, facies articularis, and these specifically serve for articulation with the corresponding bone structures. They also play a very significant and crucial role in the intricate formation of various joints throughout the body. The individual fingers can be systematically numbered, with the prominent thumb always being consistently assigned the number 1, the digit closest to the wrist, followed by the other digits in sequential order. The index finger is designated as number 2, while the middle finger is assigned the numerical value of 3. Following this, the ring finger is identified as number 4, and the smallest digit, the little finger, is specifically assigned the number 5. These distinct digits of the hand also possess their own traditional Latin names. For instance, the very first digit, which is commonly known as the thumb, is formally called the pollex. Moving on, the index finger, often used for pointing, is known by its Latin designation, the index. Subsequently, the middle finger, positioned centrally among the digits, is referred to as the digitus. The ring finger is precisely known as the digitus annularis, while the little finger is accurately termed the digitus minimus. Each of these individual fingers is fundamentally made up of 3 distinct smaller tubular bones, with the notable exception of the thumb, which has a different structure. The general anatomical structure of the fingers is consistently organized as follows. There is a proximal phalanx, which is the bone closest to the palm, an intermediate phalanx, situated between the proximal and distal phalanges, and finally a distal phalanx, which is the outermost bone of the finger. A distal phalanx, and between the two is the middle phalanx, so there is a proximal phalanx, a middle phalanx, and a distal phalanx. The exception to this is the thumb, as it only has a proximal and a distal phalanx. It does not have a middle phalanx. It's important to note that it's called the middle phalanx, not the medial phalanx. Their general structure is similar to that of the metacarpal bones of the hand, meaning they have a proximal and a distal epiphysis, with a diaphysis located between the two. These anatomical structures are also specifically named as the basis, the caput, and the corpus. However, a notable exception to this general rule applies to all 5 distal phalanges, as they do not possess a caput, but instead terminate in a very special and distinct structure, which is precisely called the tuberositas phalangis distalis. This tuberositas phalangis distalis is actually the primary attachment point for various tendons and ligaments, playing a crucial role in the overall function and stability of the digit. A robust structure that primarily serves to firmly support the delicate nail bed and the sensitive tips of the human fingers.